The project came about because the NHS is changing. So our population is getting older, their health needs are getting more complex. So we undertook an audit of patients having a heart attack, and we found that a lot of our patients were diabetic. Now, there's always been a known link between diabetes and having a heart attack and diabetes and developing renal disease. What we underestimated was the size of the problem. So when we realised a little over half of our patients had either diabetes or pre-diabetes, then we realised we needed to do more and we needed to do better.
We have a lot of challenges in this county. High levels of prevalence. One of our PCNs has the highest level of diabetes prevalence in the country. We have lots of health inequalities.
So when you want to do a project, how do you actually get the pump priming money to be able to take that forward? And that's when we got a steering group together of interested, like-minded healthcare professionals, patients, and then we approached industry partners to ask for their support. With Boehringer Ingelheim and ourselves, we wanted to be transparent and we wanted to be ethical.
We wanted it to make every contact that we had with the patient count, and to have that opportunity to optimize just not one thing, but many, many things all at the same time.
So whereas before, if you had a heart attack and you were known diabetic, we would have looked. Whereas now we look for every patient who comes through the door. Do they have diabetes?
So now what we have in our service, this new cardio-diabetes service, is that the patient comes in and then we follow the patient through with the same team. They are our cardiovascular team or cardiovascular unit with cardio-diabetes as a particular focus in our therapy management, optimization and speciality. They then get another review again after discharge to further optimize again. So in other words, we kind of get two bites at the cherry.
So they will get specialist advice while they're in hospital, which is at a time when people are anxious, they are nervous, but they'll come out with better knowledge, better understanding of what diabetes is, how they can manage their condition, and crucially about all the medications that they're on, and a much better understanding of how to take them, when to take them, and how it'll improve their diabetes care. That's, for me, the improvement in care is the biggest success of this project.
We work very closely with our primary care colleagues, pharmacists, nurses, general practitioners. It's had a benefit in many ways. So practices are overwhelmed. Our GP colleagues are working very long hours. They have to be experts in many things. So to be able to hand forward a patient who has been tested, who has been screened, who has a very clear treatment plan in place, saves them having to do it. So not only do you free capacity for GPs by managing some of that work on their behalf, but by cutting down on some of the complications, then you also free additional capacity in primary care.
We know that work with industry has in the past been viewed with some skepticism. We now realise that there is mutual benefit here. By working together in the interest of improving patient outcomes, we can do this. And that's the only way we can do it.
So working in partnership with industry, for instance in this example is with the company Boehringer Ingelheim, has actually been a much very helpful for us. Certainly not just as a resource in terms of helping us pump prime the program to get started, and now that's started and we're actually doing things a lot more efficiently, it's helping us also save cost. So we're being efficient, we're being better in doing what we're doing, and then we're achieving better outcomes for our patients too, as well as saving the NHS money. I think we're all in a win-win situation.
We also worked with primary care colleagues, community care colleagues, to upskill them on diabetes and to upskill them on cardiovascular disease, because historically, even though the disease overlaps, they've been treated by different professionals. So wherever that patient seeks advice in the future, they get a consistent message based on the latest evidence that reinforces the learning that they've already had.
From the heart centre, the advice from the heart centre was absolutely brilliant. And it was, it was consistent, everything they said to you. And that's what you need that consistency. And I'm still here, so it proves it works. You know, we need more places like it.